to my video series. I do 26 topics, an A to Z kind of thing on topics to do with pregnancy and perinatal mental health. Today we're up to G for gestational diabetes. So actually the next kind of 3 videos are probably a little bit more personal this time because they're all things that I've personally experienced. So it's kind of like a adjusting to things, how I've coped with things and some tips along the way. So when I was diagnosed with gestational diabetes, I was actually really surprised. You know, I'd gone along and taken the horrible sugary drink and thought, okay, yep, it's a formality, that's it, nothing more to it. You know, I probably wasn't that different to lots of other women in thinking I'm not the sort of person who's going to get diabetes. You know, there's no risk factors for me. You know, I exercise, I eat pretty well, I generally look after myself. There's nobody in my family with diabetes. Didn't really seem that likely to me. So when my care provider rang me and said, yep, this is the case, you've shown positive, I was pretty upset, like I suppose to start with, because, you know, even though I should know better, at the time I just thought, oh, what have I done wrong? Like, should I have not eaten that salted caramel cruffin the other week? Am I, you know, having too much sugar? What am I doing? I'm obviously not looking after myself as well as I think I am. But I think that's a common reaction, and it's something we have to remind ourselves that, you know, gestational diabetes is caused by pregnancy. It's just the way that our bodies cope with having extra pregnancy hormones flushing around our system, and our blood sugar levels don't cope sometimes. So, you know, in my case it was fairly mild. It was managed with diet and exercise, and, you know, look, honestly, testing your blood 4 or 5 times a day, making sure your meals are planned and that you're eating every 2 hours. It's a bit of a pain, but it is manageable. And really, like, my 3rd trimester was probably the best. For me, I felt the best because I was really properly looking after myself. But we know plenty about the kind of physical management of the illness. There's not a lot about the psychological impact of the illness, and I wasn't really particularly given any support about coping with it. You know, I saw a diabetes educator and she was awesome. She was really great at helping me with managing the physical parts of the illness, but her advice, you know, generally was, oh, don't tell people. Don't tell people, because you'll constantly have people on your back saying, oh, should you be eating that? Should you be doing that? Which we all get in pregnancy anyway, and it's annoying. So it kind of made me think actually about how we treat women who have this diagnosis and how we think about ourselves, you know, from a body image point of view, and the kinds of reactions that people have. I mean, a lot of people, when I told them, were equally surprised as I was, but they felt the need to add little extras, I suppose, like saying, oh, but you're so petite. Like, only fat people get diabetes, don't they? Which, you know, talking about people's weight and shape when you're pregnant, or even if you're not pregnant, anytime isn't, you know, a wonderful experience to go through. But people seem to have their preconceived ideas about illnesses and who gets them and who doesn't. And we know that, you know, in lots of ways, gestational diabetes doesn't discriminate. You can get it if you're healthy and you're not overweight and you don't have any risk factors. So coping with an illness that doesn't have any physical kind of outward, you can see that somebody's unwell and you don't feel unwell and there's no symptoms, it's a bit of a thing to get your head around. So I think for me, the going and seeing the diabetes educator was great. As I said, look, I thought of myself as someone who was pretty healthy, and I am generally pretty healthy, but there are things in my diet that I didn't know, I suppose, were spiking my blood sugar. You know, things like brown rice and watermelon, which sound like healthy foods, are things that are not great choices. I mean, obviously it's not as bad as having, you know, hot chips and white bread and lots of chocolate and sweet things like that. But there are healthy things that we think, oh yeah, I'll eat that, that's healthy, that aren't as great for our blood sugar levels as we think they might be. So it's a pretty handy person to know and to just go and see and just, you know, have somebody nitpick at what you're eating to make sure that you are just keeping your blood sugar levels consistent. The other thing, of course, is having supportive family and friends. You know, you need people who understand that, okay, you've had your dinner and now you need to wait 2 hours before dessert. You can't just scoff that bowl of ice cream as soon as you finish your dinner. So they're happy to wait, and it's not like a big deal, and you don't have people going, should you be eating that? You need people to just be like, okay, I trust you to manage your own illness and I'll leave you to it. I'm here if you need me, but I'm not going to tell you what to do. I think also, like, realizing that you have choice. I mean, You don't have to go and have any tests done that you don't want to do. You're able to go and do your own research, make informed choices and decide what is best for you, which is so important in pregnancy anyway. You know, having things like assertive statements ready when people do hit you with the like, oh, is that why you're so big? Or, oh, but you shouldn't have diabetes, you're so small, or whatever you're going to get. And actually I got both. At one stage in my pregnancy I did have people saying, is that why you're so big? Please don't comment on pregnant people's bodies, it's just not necessary. But anyway, so I had just up my sleeve the kind of like, you know, no, I'm not worried about having a big baby. You know, my body's not going to grow a baby that's too big for my body. So having things, you know, that you can just kind of roll off the cuff, that you don't have to think about. That's, I suppose, the polite way of saying back off. If you feel like being polite, you're pregnant. You don't always have to be polite if you don't want to. So I think coping with it, it's a matter of deciding if you want to tell people about the illness or not, knowing that it's your choice, and just, I suppose, accepting the journey that your pregnancy is taking. You know, as I said, in most cases, if gestational diabetes is mild, it's going to be managed fine. There's not going to be a lot of changes that you have to make to your lifestyle, and it will go away when Bubs is here anyway. So it's just a matter of going, okay, this is how pregnancy affects my body. It's okay, I can manage this. Alright, so if you have any other anxieties, worries, concerns about pregnancy, or you just want to learn some good relaxation tips, you want to learn about the physiology of birth and how to have a really calm, positive, awesome birth, I'm doing hypnobirthing sessions every month, and I do perinatal counselling as well, for things like birth trauma, anxiety, just general coping with pregnancy and parenting in the postnatal period as well. So feel free to get in touch, and I will talk to you in my next video. Bye.